Then you need to develop a short list of the facilities or the agencies you wish to contact. Talk to people you know, talk to friends and family and people you know that have had loved ones in the nursing home. And make sure you don't talk to the person who says, oh, it's just wonderful. Mom is there just great. He visited her once a year, what does he know? Make sure it's someone that's been there and knows what they're talking about. And use the 5-star rating system. It can be a guide to help you get started because you need to narrow down your choice. So remember, one of the primary considerations too is, where is the facility located? It is important that family and friends be able to visit. So you want to, nothing's going to do more for their spirits than seeing your face. And so make sure it is convenient. So you call and make an appointment, you visit the facility. Now you're going to go through the facility. Now she's going to tell you all the most wonderful things about her facility, she or he is, because they are the marketing director. So what do you want to look for? Well, a lot of us know right away you need to use all your senses. You're going to smell. Does it smell good? Well, of course, they may be really perfuming up the front because they all know that when you walk in too. So walk through the whole thing, even if she doesn't show you somewhere. Go in anyway. And talk to everybody you meet. Are they friendly and are they welcoming? Talk to the nurses, talk to the maintenance guy, talk to the cooks in the kitchen. You can tell how they like their job or how their day's going. So you have to get a feel for their place. Do they seem to be enjoying their work? Do they talk to each other? Are they talking to the residents and are they calling them by name? Check the railings. Run your hand along it. Is it sticky or is it clean? And noise levels. A lot of times the dining rooms can be so noisy. Go sit down in the dining room and see how loud it is. People with hearing problems can really have a hard time when there's all that clanging going on in the bathroom. Like background. Like, where's the kitchen located? Is it off a little bit, or recessed a little bit, so you don't hear all that noise in there? Are there maybe curtains on the windows, fabrics to like absorb some of the sound? Is it noisy? And look at how the people, are they being helped, being fed? They need it? Are they, at one place I saw medication had been dropped on the floor and nobody seemed to notice. It was after they had got finished eating. And then I waited to thinking, okay, I let them know that someone had dropped their medication. And then after the residents had all left, I thought, I wonder how long it's going to take them to clean this up. And I was there for an extended period. They didn't. The food was on the floor and they were going to have an activity and they simply brought the people in, and I really thought, I did not think highly of this facility. That should have been cleaned up immediately. There was no reason for that. But the residents were walking around it. They could have easily slipped on something on the floor. They should be very attentive to that. Also, go in and visit on your own then. After you've taken the tour and you've looked at all kinds of things there, come back on your own. And how about going back on a Saturday night? If you want to see how the staffing really is and how everybody's getting along, go back on a Saturday night. See if you can have dinner there. And you'll see, does the staff think in a hurry? Are there enough of them, or are they just like really bummed out that they're there on a Saturday night? Is there someone at the front desk? Then look at the activities calendar. There should be one posted. And is there a good variety? Do they have activities outside the facility? Do they provide transportation for them? There should be a nice variety of activities, and you can think about your loved one's needs and wants. And is there other things there that might interest them? Would it be good for them? Look at what type of personal care is available. What type of medical care? What is the cost of the care? And especially in some of the assisted living that I've seen, there's a base price, and then there's Plan A, Plan B, Plan C. Okay, this is the different kinds of care. Well, all of a sudden you need Plan B. You don't really need it all, maybe, but that's going to be added on to that cost. So base price plus that Plan B. But then some facilities also have a la carte. where you just pay for what you need and actually pay for what level you need. Like you can have bathing, you can have somebody just stand by, you can have somebody actually assist you, or you can have somebody give you a bath, and there's a price for each one of those. You know, that can get very confusing, but you may want to do it that way. But you could do the Plan B that has several things involved in it, and it takes a lot of guesswork out of the equation. But look at that, because there is price creep up in that kind of situation, and before you know it, you may be out of your budget. So now, if your loved one has dementia, or is there a memory care unit, or do they specialize in Alzheimer's care? What about if your mom loves to garden? There are facilities that have gardening clubs, and they have raised gardens that are wheelchair accessible. You can roll right up. There's also things like, do they have a book club? Someone you may read to you, or you may read your own. It depends on their interest, and everybody's different. So while you are, so find out what mom and dad's needs, wants, and goals are. Then choose the type of healthcare facility that most meets those needs and can achieve those goals. And then, what you want to, while you are at it, you will have to narrow down your priorities. And a crisis, of course, may make your medical needs a priority over everything else. But a person will be happiest in a setting that most reflects their values and their habits of a lifetime, and those that meet their needs to maintain as much independence as possible and quality to their lives, and where they are treated with the respect and the dignity that they deserve. So I also have some resource guides. This is one that's put out by the Area on Aging. Has a nice listing in here for you. Saves you of all different kinds of facilities. Saves you the trouble of looking it up or going to the phone book. It's very good. And I also have, now these I have available here. This is the Alzheimer's resource book, and it has all our different counties in it. It's all the agencies there. And I have a bunch of different materials that you can help yourself to.